Welcome to the third video in our series, which will explore the AAA core service area of caregiver support. The Older Americans Act requires that all area agencies on aging offer services that support family caregivers. But before we start discussing these types of services, we'll take some time to learn more about family caregivers themselves. At some point in many people's lives, they will experience being a family caregiver. A family caregiver is someone who routinely helps a friend, neighbor, or a loved one and is not paid to do it. They don't have to be family of the care receiver, but oftentimes they are. So when we use the term family caregiver throughout the rest of this presentation, we're talking about these informal caregivers, not paid or professional caregivers. Family caregivers may be doing tasks such as helping with various IADLs or ADLs, like managing finances, grocery shopping, housework, care planning, transportation, medication management, bathing, or mobility tasks. In the earlier stages of caregiving, someone might just be helping a loved one balance the checkbook and probably doesn't really think of themselves as a caregiver. Rather, someone who helps mom on the weekend. So for many, this is a job that they were not asking for or looking for, rather one that fell into their lap, which is important when we think about the implications that being a family caregiver can have on the health and well-being of a patient, and on the long-term care system as a whole. Unpaid family caregivers are critical to health outcomes for the patient. They are taking on many tasks that were formerly provided by medical professionals, and many are doing so without any real training. Therefore, they have a large impact on the health status of the patient. Many caregivers who are performing medical or nursing tasks feel they have no other option. If they didn't do this type of care, their care receiver might not get the care elsewhere. Unpaid family caregivers are also critical in a financial sense as well. Not only are they helping keep their loved one healthy, which likely lowers healthcare spending, they're also delaying the need for formal institutionalized care, like nursing home placement. Family caregivers provide tremendous value. If we think about this in terms of Washington's Medicaid long-term care system, delaying the need for Medicaid long-term care means that families do not have to impoverish themselves to gain access to help. Participating in caregiver support services in Washington delays the need for Medicaid long-term care by almost 2 years, which is really interesting when we consider that nearly all of the care receivers whose family caregivers participate in Washington's caregiver support program would actually be eligible for Medicaid long-term care, meaning these are folks who have high ADL needs. Yet, they're not needing to use that Medicaid long-term care program. They're using a much lower-cost option instead. If unpaid family caregivers were not providing care, our long-term care system would simply be overrun. We do not have enough paid caregivers, assisted living facilities, adult family homes, and nursing facilities to effectively meet the needs of the population that actually needs care. So we need to do our best to make sure these family caregivers have the support that they need to continue providing care in a safe and loving way. As you've seen, family caregivers are critical to the health and well-being of older adults with functional or cognitive impairment. Yet, family caregivers face barriers in being able to provide care to a loved one long-term. This is because family caregivers are less likely to attend to their own health and well-being. Numerous studies have shown that family caregivers are often sleep-deprived, have poor eating habits, don't exercise, don't rest or take care of themselves when they're ill, and also postpone their own medical care. This is particularly concerning when we consider that 18% of spouse caregivers of dementia patients die before their patients. If a caregiver isn't taking care of themselves and can't provide quality care in the long run, what happens to their loved one? When we consider these barriers, we want to make sure that caregivers are taking care of themselves so that they can be the best caregiver for their loved one. Family caregiver support programs can help caregivers take care of themselves. Family caregivers are also at risk of caregiver burnout, which is a state of physical, emotional, and mental exhaustion which happens when caregivers do not get help early enough or try to do more than they should. In small doses, the tasks of caregiving are probably manageable for most people, but when care progresses to a point where they have to juggle competing demands of caregiving and their own life, it can be quite a challenge. If time demands are heavy, a caregiver can become exhausted, stressed, and prone to burning out. They might feel that they should be able to handle their regular life and caregiving, so when they struggle, some complicated feelings can arise, such as feelings of guilt or even depression. A caregiver experiencing burnout is also more likely to abuse or neglect their loved one. Therefore, we want to help support caregivers before they reach burnout. We hope to prevent them from ever experiencing it. Caregiving for someone with Alzheimer's disease or dementia is often more stressful than caring for a person with a physical disability. Caring for someone with dementia frequently involves a lot of oversight in managing behaviors like wandering, emotional outbursts, and inappropriate actions, which can leave a caregiver feeling overwhelmed and isolated. Yet, many of these caregivers are not aware that their loved one even has an official dementia diagnosis in the medical record. Studies done by the Alzheimer's Association report that only 45% of patients or their caregivers who have a diagnosis of Alzheimer's disease in the medical record are actually aware of that diagnosis. Without knowledge of the diagnosis, many families may miss out on accessing information, support, and guidance that would be very helpful during their care journey. Now that you have a better understanding of family caregivers, we'll talk some more about the ways that AAAs in Washington are providing support to family caregivers. To help us determine what services will be best suited to each caregiver in each caregiving situation, the caregivers undergo an assessment that helps AAA staff understand where that caregiver is on their caregiving journey. The assessment measures a caregiver's stress and depression levels. It also examines the impact of caregiving on their day-to-day life and on their relationship with their care receiver. Based on the caregiver's answers, the AAA has services available to help support caregivers. These services typically include things like case management services, so that the caregiver has someone to reach out to for support who can answer questions. Education to help caregivers learn skills to care for themselves, direct care skills, and other topics related to caregiving. Support groups so that caregivers can connect with other people who get it. Respite so that they can get a break from caregiving. Supplies and equipment so they can access durable medical equipment, incontinence supplies, or personal emergency response buttons. And counseling to help them process the difficult emotions that can come along with caring for a loved one. As you can see, Washington has many options available to help support family caregivers. Over 75% of caregivers who participate in Washington's Family Caregiver Support Program are caring for someone with a suspected or diagnosed memory impairment. Be sure to take a look at the supplemental video to hear more from family caregivers in Washington State about how family caregiver support has impacted their lives. Next, let's look at a case study of a patient who was referred over to the AAA. The patient is a 70-year-old female with dementia who was hospitalized due to a UTI. The reason for the referral was to help with ADLs. The patient's husband is her caregiver and is very involved in her care. He states that he is struggling to bathe her and that she can be aggressive, which is stressful for him. He's feeling overwhelmed, but is adamant that he is going to keep her at home. That's his duty as a spouse. The family caregiver was encouraged to maintain his regular doctor's appointments, provided with a case manager to consult with as needed, connected to a dementia support group, authorized for 20 hours of in-home respite care a month, and given educational information and resources about dementia. He is now feeling more in control of the caregiving situation and is much more patient with his wife. There are two evidence-based options for Alzheimer's and dementia that might be available at your local AAA. The first is the Reducing Disability in Alzheimer's Disease, or RDAD program. This program can help people living with dementia by helping them maintain physical function and remain physically and mentally healthy. RDAD combines exercise training with teaching caregivers how to manage dementia-related behaviors. Another evidence-based program for dementia is the STAR-C program. Here's some more information about STAR-C from one of our STAR-C coaches.
STAR-C is a one-on-one training program developed for family caregivers caring for a loved one with Alzheimer's or dementia. The focus of the program is working on identifying triggers that cause problem behaviors in their loved ones and learning strategies to help minimize or prevent problem behaviors from occurring. The program is 6 weeks long with 1-hour sessions per week with a trained STAR-C coach. In these sessions, caregivers identify behaviors they see in their loved ones and work with the coach on identifying possible triggers that might be causing the behavior, and then choosing a couple of different strategies to try over the coming weeks to see if they can minimize or stop the behavior from occurring. Caregivers learn how to become super sleuths and dig into what surrounds the behavior, what happened just before the behavior, and then how did they respond to the behavior? Did that make it worse or did it make it better? Toward the end of the program, we work on identifying pleasant events that the caregiver can introduce during the day to help the care receiver and their overall mood, again in the hopes that improvement of mood can help minimize or avoid the problem behaviors from occurring.
Many AAAs in Washington and around the country offer the Powerful Tools for Caregivers course as part of their family caregiver education offerings. Powerful Tools for Caregivers is a 6-week, evidence-based class designed to help family caregivers develop and practice self-care tools that help them master caregiving decisions while managing the responsibilities and thriving as individuals. Each week, the course covers topics that teach a caregiver how to take care of themselves, identify and reduce stress, communicate their feelings, needs, and concerns, communicate in challenging situations, and learn from their emotions. Let's hear a little bit from one of our Powerful Tools for Caregivers class leaders.
Powerful Tools for Caregivers is a 6-week course designed for unpaid family caregivers, and classes are kept small in order to allow caregivers to feel comfortable sharing with one another. Each session builds on the last one and covers a range of topics, including dealing with difficult emotions like caregiver stress, depression, guilt, as well as focusing on self-care skills, including communication strategies, guided relaxation exercises, deep breathing, and making weekly action plans.
The AAA can also help connect you to valuable resources designed to help caregivers. The Caregiver Stress Self-Management Plan is a free resource that was designed by AAA staff and helps caregivers identify when their stress level might be a cause for concern for them. The reverse side of the document contains a quick caregiver burden screening to help caregivers recognize if they're heading towards burnout. It also offers helpful information about what they can do if they need help. If you're looking for resources to give out to caregivers, check in with your local AAA to see what they would recommend, or if they have any they could provide to you. In addition to general caregiving resources, AAAs often partner with groups that provide valuable dementia resources. In Washington, many AAAs partner with the Alzheimer's Association and the Washington State Dementia Action Collaborative to offer high-quality classes and resources. AAAs can help connect family to early-stage memory loss workshops, Alzheimer's cafes, or dementia-friendly walking groups that may be available locally. They may also have materials available such as the Dementia Roadmap, Dementia Legal Planning Toolkit, or Alzheimer's Association Helpline brochures. The Dementia Roadmap is a fabulous guide put out by the Washington State Dementia Action Collaborative. Many providers we work with find that this is a helpful tool to provide to family members of someone who has been recently diagnosed with a cognitive impairment or dementia. The roadmap helps people understand the difference between normal age-related declines, mild cognitive impairment, and the different stages of dementia. It offers helpful insight into what families can do at each stage to help their loved one prepare for the road ahead. The Dementia Legal Planning Toolkit is another great resource offered by the Washington Dementia Action Collaborative. It's a fantastic tool that walks caregivers through the process of making sure that they have their legal paperwork in order when their loved one has dementia. It helps people understand documents like powers of attorney and advance directives and why they would actually need these. It also offers blank copies of durable power of attorney and mental health care advance directive forms with the booklet. This is a great resource for people who may not be able to afford to hire an attorney to complete this paperwork on their behalf. AAAs also provide resources from the Alzheimer's Association, like their 24/7 helpline. The helpline is a free service that is available any time of day or night, every day of the year, to caregivers who might need help with decision-making support, crisis assistance, or education on issues that family members face every day. Switching gears a little bit, another program that might be part of the AAA is the Kinship Support Program, which is support for grandparents or other family members who are raising a relative child. So, for example, grandparents who are raising their grandchildren, or maybe an uncle who's raising his nephew. The Kinship Navigator program provides support while helping family members embrace the new and unique challenges of becoming a parent again. Next, let's look at a case study from one of our Kinship program clients. The patient is a 65-year-old female who lived in a studio apartment at a low-income senior housing facility. She was stressed because her 3 grandchildren, ranging in age from 12 to 15, were recently placed in her care after their mother died of an overdose. Their father is not in the picture. The patient is now facing eviction from her housing complex, or having to put her grandchildren in foster care. The Kinship Navigator worked with the patient's housing complex to gain an exception to policy that allowed the children to live there and also helped the patient secure a 2-bedroom apartment within the same complex. A financial voucher allowed the patient to purchase bunk beds and basic hygiene supplies for her grandkids. So as you can see, just this simple engagement with the Kinship Navigator program was able to help keep this family together. Be sure to take a look at the supplemental video to hear more from kinship families in Washington State about how the Kinship Navigator program has impacted their lives.